Most of us have heard the phrase, practice makes perfect. It's one of the things you've either heard from your parents, a coach maybe, a teacher. But personally, does practice really make you perfect? Is perfect something that's actually attainable? I don't believe that so much. I think that practice does increase your ability to do something in a timely manner. And currently, we are able to use practicing in multiple situations in the medical industry in order to make surgery more effective. My last speech, I spoke about arthroscopic knee surgery, the benefits of it, and some complications that may occur. I, myself, had arthroscopic knee surgery. My surgeon was trained with a certain program, which I'm going to explain to you right now. We are currently able to utilize a simulator that can take images that would diagnose you, take those images, create a program, and then the simulator would mimic your actual knee without performing surgery beforehand. So this just shows, this is a picture of an MRI. We will take multiple MRIs and form a program that the surgeon is able to practice before actually making an incision in your body. This is an extremely valuable type of system because you do not have to really have a high risk. You can practice as many times as you need to before putting a patient under the knife. In my speech, I am going to discuss, first of all, a little bit more about how the simulator works, where it is currently used, and then I'm also going to go into how we can implement this on a larger scale throughout the United States to make more of an impact in our health. So first of all, as I said, we will be MRI images are able to create a program, a simulator system. This creates a 3D volumetric model. So as shown here, this is actually shaded as a result of multiple precise images so that you can visualize firsthand what it's actually going to look like once you make the incision. Then the simulator, which you can see hands right there controlling it, to actually not only manipulate on the screen what you would potentially be performing, but it also gives you feedback. This is able to occur because of the haptic or the touch sensors within the simulator. So this, from the outside, the simulator just looks like kind of a prosthetic knee, nothing really, mechanical about it. But when you take the outside covering off, it looks like, something that's a lot more complex. What's happening is all these images are comparable to, say, a video game. And in a video game, I'm going to use Mrs. Pac-Man, Mr. Pac-Man, because I think a lot of us know what that is. You have your path, your course. And that's comparable to the images that you would see up on the screen. Then, typically in a video game, you have a joystick. In this case, you have to use both hands, unfortunately, right? But you can see that those would control what you're moving up on the screen. So this allows, basically, for the surgeon to play a video game of the dental surgery that they would be performing prior to making incisions, which is so beneficial for multiple reasons. First of all, with knee surgery, sometimes you need to be comfortable with different angles that you would be performing it at, and just get a feel for what you're going to be seeing before doing anything. Also, the knee contains more than just tissue. There's also bone and cartilage. So it's very unique in the sense that this model can tell you how dense something is beforehand. Currently, this type of process is being used at Massachusetts General Hospital and also Stanford University for research within the United States. Looking at this, they have found that there is a significant decrease in error with the use of the reverse reality, as they call it, trained program. So this is just what they're using now, right now, standard training, nothing very nothing that really is preventative. It's more or less looking at certain images beforehand and then going and performing surgery, as opposed to actually being able to practice, with the virtual reality trained. There's a decrease in about 6 errors per procedure. Looking at the length of procedure also, there is a decrease because you have done it before. The surgeon would be familiar with what is going to be occurring. And even though that's only about 5 minutes, those 5 minutes do add up over time and is extremely significant. This process is currently being used in other countries in Europe, even more broadly, such as Switzerland, Germany, and the Netherlands. Boston Scientific actually opened their first plant up in England before bringing it to the United States. And all this occurred more in Europe in the 1990s as opposed to what it is now. We are currently trying to push further simulation within the United States. So, excuse me. Virginia Congressman Randy Forbes, a Republican, has started this new idea of the Modeling and Simulation Caucus within the government right now. And he's supported by a co-founder, Robert Kennedy of Rhode Island, and who's a Democrat. And together they are trying to push this new idea of education through simulation through their Enhancing Simulation Act, which is actually a very, very long acronym. Simulation stands for Safety in Medicine. Safety in Medicine utilizing adaptive simulation technology for improvements in outcomes now. So it's extremely long, but basically they just brought it all and said simulation. So it's interesting how they are promoting this, though, through different conferences. They have been actually inviting other congressmen and representatives to test out the machinery themselves and get a feel for it, which is really beneficial. Because currently, right now, in hospitals, we have the apprenticeship model, which is see one, do one, teach one. So if anyone's ever watched any doctor shows on TV, it's actually very similar in the sense that you observe, then you perform, and then you have to teach others. But with the addition of the simulation model in hospitals and more universities, we would be able to change to the see one, practice many, do one. This is, in the end, more cost-effective because liability would go down, and also we would be able to practice multiple times. So, as I showed before, the time that would go down and error would also decrease. So, it is important that we begin using more and more simulation models within the United States because it has shown beneficial effects in the way surgery is performed. In especially arthroscopic surgery, you will get a better feel for the actual materials, the bone, the cartilage, and the tissue that would be manipulated during the surgery. I believe that with the addition of the Simulation Act presented by Randy Forbes, we would definitely benefit as a nation when it comes to health policy and health costs. Right now, think about it. Police officers aren't just handed a gun and sent out to work. We don't just put astronauts up in space without them going through a specific training program. Doctors handle the lives of our friends and family every day, and it is important that they are trained with the best technology possible. Thank you.